Hi, my name is Elaine. I'm the clinical nurse manager here in Cath Lab in UPMC Whitfield, and I'm just going to give you an introduction to cardiology. So cardiovascular disease remains the most common cause of death in Ireland. It's currently the cause of 1/3 of all deaths and 1 in 5 premature deaths. Cardiovascular disease is a general term used associated with conditions that affect the heart, of blood vessels, and these conditions can cause heart attack, stroke, heart failure, and peripheral vascular disease. Other conditions that fall under cardiovascular disease would be congenital heart disease, heart valve disease, and disease of the heart muscle. So coronary artery disease is a condition that falls under the umbrella of cardiovascular disease. It is caused by a plaque buildup in the wall of the arteries that supply the blood to the heart. Plaque is made up of cholesterol and/or deposits and cause the inside of the arteries to narrow over time. This process is called atherosclerosis. Atherosclerosis comes from the Greek language and means hard porridge. Arteries can become damaged over time by atherosclerosis. The narrowing of the arteries reduces the flow of blood to your heart muscle. This is what's commonly called hardening of the arteries. So just some symptoms that may indicate cardiovascular disease. So angina is chest pain caused by the reduced blood flow to the heart muscle. Angina is a tightness or pain in your chest that may spread to your left arm, neck, jaw, or back, which can be brought about by physical activity or stressful situations. Angina can be stable, attacks have a trigger, and symptoms usually pass within a few minutes of resting. Or it can be unstable, where attacks are more unpredictable and can continue despite resting. Other symptoms to be aware of are heart palpitations, shortness of breath, nausea and/or vomiting, fatigue, or syncope, which is fainting or passing out. If you have acute chest pain that does not settle after a few minutes, you should seek urgent medical treatment at your emergency department. Women can present with atypical symptoms and tend to present later than men. Patients with diabetes also present with atypical symptoms. So just to go through some of the risk factors, we have non-modifiable and modifiable risk factors. So just to start with the non-modifiable, so age, the heart muscle may not relax completely between beats, and as a result, the pumping chambers become stiffer and may not work. So gender, prior to 60 years of age, men are at greater risk than premenopausal women, and following menopause, the gender risk equalizes. Family history, so risk is increased if a direct family member has experienced cardiovascular disease, including familial hypocholesterolemia. Ethnicity, so people with African or Asian ancestry are at higher risk of developing cardiovascular disease. Socioeconomic status, so this is defined as low education level, low income, holding a low status job, or living in a poor residential area, have an increased risk of developing cardiovascular disease. So stress, a chronically stressful life, social isolation, anxiety, and depression contribute to the risk of cardiovascular disease. So raised or altered level of blood cholesterol. So for people with established heart disease or diabetes, we aim for a total cholesterol of no more than 4.5 millimoles and an LDL of no more than 2.5. LDL is also known as bad cholesterol. So raised triglycerides with low HDL, which is known as good cholesterol. So can be inherited, but also occurs in people who are overweight, especially when the excess fat is carried about the waist. Weight reduction and regular exercise can help. The hypertension, this is one of the most powerful modifiable risk factors. Risk is increased if a family member has previously been diagnosed. It can also be influenced by lifestyle. Diabetes, so patients with diabetes are at a much higher risk of cardiovascular disease. The risk is further increased if they also have hypertension and elevated blood lipids. Smoking is the single most important preventable cause of premature mortality. Overweight or obesity. So diet, the food pyramid, so limiting intake of salt and aiming for less than 5 grams of salt per day. Sedentary lifestyle, so inactivity is a major contributor to cardiovascular disease. Regular exercise can reduce blood pressure, control weight, and reduce waist circumference. So harmful use of alcohol. Alcohol should be consumed in moderation. So the max weekly limit for a woman is 11 standard drinks and 17 for a man. Excessive stress. So acute mental stressors may act as triggers for acute coronary syndrome. Chronic stress can contribute to cardiovascular disease, as can clinical depression, panic attacks, and anxiety. So renal insufficiency. Minimal alterations in renal function have been described as potential cardiovascular risk factors. So just to go through some of the cardiology testing, we start with the non-invasive testing. So to gather more accurate information in order to make a specific diagnosis, there are many non-invasive tests that can be carried out in the cardiology department, such as electrocardiogram, echocardiogram, Holter monitoring, blood pressure monitoring, or exercise stress testing. These tests are usually conducted by a cardiology trained nurse or a cardiac physiologist. So just to explain, electrocardiogram or ECG is a test that records the electrical activity of your heart, including the rate and rhythm. It's performed by placing stickers on your chest and attaching cables to them. Echocardiogram or echo is a simple test which uses sound waves or ultrasound to take a moving picture of your heart. It allows your doctor to see how your heart muscle is working and how your heart valves are opening and closing. It's performed by placing cold gel on your chest and moving the probe over it. Holter monitoring. A Holter is a small battery-powered medical device that measures your heart's activity, such as rate and rhythm. It's performed by attaching the cables to stickers on your chest, and you might need to wear it for between 24 and 72 hours at home. Exercise stress testing is a screening tool for the detection of significant coronary artery disease. It is used to determine how well your heart responds during times when it's working its hardest. During the test, you'll be asked to exercise, typically on a treadmill, while you are hooked up to an ECG machine. This allows us to monitor your heart rate. This test can show if the blood supply is reduced in the arteries that supply your heart. So moving on then to some invasive testing. If the test results from any of the non-invasive tests show an indication for the cardiologist to further evaluate your clinical condition, they may request an invasive test or procedure, such as an implantable loop recorder, a transesophageal echo, cardioversion, or insertion of pacemakers. These tests are performed in the cardiac catheterization lab or cath lab. The trained professionals that you might come across in the cath lab while in for a procedure would be consultant cardiologist, cardiac nurses, and cardiac physiologist. So just to start there with implantable loop recorder, this is a device that records the heartbeat continuously for up to 3 years. It's also called a cardiac event recorder. The device tells your care provider how the heart is beating while you do your daily activities. It's placed under the skin on your chest during a minor procedure under local anaesthetic. Transesophageal echo. So a small probe is passed down into your esophagus, allowing detailed pictures of your heart structure to be seen because your esophagus is right behind the heart. You'll be heavily sedated for this procedure. Cardioversion. This is a medical procedure that uses quick, low-energy shock to restore a regular heart rhythm. It's a treatment for certain types of irregular heartbeats or arrhythmias, including atrial fibrillation. Sometimes cardioversion is done using medications. You'll be asleep for this procedure. So cardiac device insertion, permanent pacemaker, and implantable defibrillator and cardiac resynchronization therapy are medical devices used to treat heart conditions. Permanent pacemakers are used to treat bradycardias or slow heart rates. ICDs are used to treat dangerous ventricular arrhythmias, and CRTP and CRTDs are used to treat heart failure. There is an incision made on the chest wall and the device is placed under the skin. The device is connected to leads that are attached to the heart. You will receive local anaesthetic and possibly some sedation for this procedure. Coronary angiogram. So a coronary angiogram is a test that uses X-ray to look at the heart's blood vessels called the coronary arteries. It's usually done to see if a blood vessel is narrowed or blocked. A coronary angiogram is most often used to diagnose coronary artery disease. For this procedure, you will receive local anaesthetic and possibly some sedation. A small tube is placed in the artery in your arm or leg. A thin flexible tube called a catheter is placed in the artery and guided to your heart. You shouldn't feel it moving through your body. Once the catheter is in the correct position, dye flows through the tube into the heart's blood vessels, and X-ray images are taken to see how the dye moves. There's just an image there. Coronary angioplasty. So this is a procedure used to widen blocked or narrowed coronary arteries, the main blood vessels that supply the heart. The term angioplasty means using a balloon to stretch open a narrowed or blocked artery. However, most modern angioplasty procedures also involve inserting a short wire mesh tube called a stent into the artery during the procedure. The stent is left in place permanently to allow blood to flow more freely. So electrophysiology studies, also known as EP studies, are tests that help the doctor understand the cause of abnormal heart rhythms or arrhythmias. During an EP study, a thin tube called a catheter is inserted into the blood vessel in the groin that leads to your heart. Specialist electrodes are placed in the heart to send electrical signals and measure electrical activity in your heart. You will get local anaesthetic and possibly some sedation for this procedure. Cardiac ablation is a procedure that treats the abnormal heart rhythm. Usually you will receive some sedation or general anaesthetic for this procedure. So just to tell you a little bit about cardiac rehab, it's a continuous process of care which begins in hospital. It is a supervised program designed to improve your cardiovascular health and includes education on risk factor management, heart healthy living, and exercise counselling and training. It is offered to people who have experienced a heart attack, angioplasty and heart surgery, and increasingly to people with heart failure. There are 4 phases in cardiac rehab. So phase 1 is getting informed about your condition. Phase 2 is getting healthy. Phase 3 is about exercise and education. And stage 4 is staying heart healthy. So the cath lab in UPMC Whitfield Hospital, this was opened in February 2020. We have 1 procedure room and a 2-bed recovery room. We have a 3-bedded coronary care unit with 2 high dependency unit monitored beds. There's also 5 beds in our radial lounge. The introduction of electrophysiology studies and cardiac ablation services was in January 2024, and you might be required to attend the hospital for Blood's pre-invasive procedure. Our pre-assessment nurse will contact you to run through any pre-procedure details. So here is a picture of our cath lab. This is the procedure room. There's a lot of equipment there, but not to be alarmed. You'll be in safe hands with our staff. I just want to say thank you, and I'm here to answer any questions that you might have. I just wanted to pop up the support details from the Irish Heart Foundation. They have really good information, support and counselling services available for patients. Thank you.